All right. Let's see. It's 6:04. Oh, my clock now just says 6:05. So if it's cool with our speakers, I mean, we might as well get started. Yeah. All right. Cool. Well, hello, everybody. Thank you so much for being here. We are so excited to be able to put on this training for you guys. It's such a timely moment to do this. I mean, as you know, there's so much going on right now, and session is nuts, and it looks weird and different. And we were kind of talking about this as a staff, like initially we were thinking about putting this on in the first place, and we kind of realized like we work in advocacy, but no one's ever laid out the legislative process for us. Like you're just kind of expected to know this as you enter into advocacy spaces, but no one ever told me what like Ways and means or what engrossing a bill means. And it's really simple when it's all right there. And we figured it'd be really powerful and probably a really good resource for folks to just kind of get some background on this, just to demystify it, because it seems like it's really complicated and it's truly not. So I'm hoping that at the end of this, we can all walk away feeling a little bit more comfortable about our place in advocacy, how we can influence the legislative session, and then some idea about what is most important to work on right now as far as we're concerned. So really quickly, you all know this, but we are Washington Physicians for Social Responsibility. We are a physician-led nonprofit advocacy organization. We are a national organization, but the Washington chapter works primarily on state issues. We work on climate change, economic inequity, and nuclear proliferation. The nuclear program typically works more on the federal level things, but for economic inequity and climate, especially this year, there's a lot going on in the state. So we're pretty active in the state legislature. And we are trying to engage and equip health professionals, especially this year, because of how incredibly important the health voice is in advocacy and the amazingly disproportionate impacts that you all can make, even by taking simple actions. You just kind of need to get a little bit of background about what that means and where you can apply your efforts, and then you can make a huge difference. So I hope that you walk away from this feeling a little empowered to maybe get involved in some of the advocacy that we're doing this year. A couple just housekeeping things before we really get going. Like I said, if anybody didn't hear this that's on now, we are recording this. So if you don't want to be recorded, that's totally fine. Just take yourself off the video and rename yourself, and they'll be like you never were here. And I'd also, before we begin, I'd like to acknowledge that while we're on Zoom and we're all kind of scattered across the state, as is sort of the nature of this now, it's all very strange, and I'm sure you all are adapting to this new world. But at least here in Seattle, I'd like to acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, and would like to just honor their Indigenous sovereignty in this area. They were here first, and it's with gratitude that we are, and respect for them, that we're able to even do this work in the first place. So I think it's important that we just say that up front. Last thing, housekeeping-wise, for questions and answers, we'll have a time at the end of the presentation to address questions. So if you could, please hold off on your questions. But if there's something really burning, or if you really are going to forget and just have to ask, if you put it in the chat, we're going to do our best to try and monitor that as we're speaking and copy things over into a Google Doc that we all have access right now, and then can kind of go through it when we're actually doing question and answers. But there'll be a time at the end. So for now, if you could hold off on your questions and just kind of keep them in your head, we'll make sure to try and circle back and give folks time to ask those. Okay, so without further ado, I would love to introduce our first couple of speakers here. We have two wonderful members of WPSR who are both on our task forces. With us is Claire Richards and Laura Wilson. And I'm going to have Claire go first to say a bit about how she got involved in this, why health professional voices, particularly in this moment in time, are extremely important in advocacy. I don't want to take what she's going to say, though. So Claire, just to give it a bit of a background, is a PhD and an RN and a loving mom. She's got a 5-year-old and is an assistant professor at the Washington State University College of Nursing in Spokane. Claire's research focuses on quality of care for patients with serious illnesses and their families. So Claire really got involved in this work when she started to notice that the impacts of climate change on her patient population, as well as her own community and family, and started to expand the focus of her work to include environmental drivers of health outcomes, things like power outages. She is a graduate of University of California, Berkeley, with a BS in chemistry, Duke University with a BSN, and University of Washington with a PhD in nursing science. Additionally, Claire completed a postdoctoral fellowship in health services at the Department of Veteran Affairs in Seattle. And so it is my pleasure to turn it over quickly to Claire Richards.
Hi, thanks for having me, and thank you everyone who is here tonight. I really appreciate you all being here and thinking about how do we make change. That's awesome. So they asked me to share a little bit about why I have started doing advocacy as a health professional. But really, I actually started as a mom because, this is really about an intergenerational problem. And looking as a mom of a 5-year-old, I look at my child and I say, I love him so deeply. It's like the deepest kind of love, and it makes me connect more to other moms who also love their children in the same way that I do. And I believe that every child should have an opportunity to thrive and have a full life. So that's really what motivates me to be active in climate change. And I use my my knowledge as a nurse and my training as a nurse and as a scientist to advocate for change. And part of it is that nurses are the most trusted profession. And we also nurses are very good at communicating with patients about things in a way that's more it helps people understand how things are affecting them and think about their quality of life. And that's one thing that I've learned also from talking about climate change with nursing students, and is that they are very good at thinking about how do we translate this into how this is impacting our patients. And in communicating and that helps me in advocacy because by translating climate change and these really abstract ideas into asthma exacerbations and hospitalizations, it shows people how climate change is impacting them now. And that's been one of the barriers in climate change and making changes on climate change, is that people don't realize they think climate change is still going to happen in the future, even though we know it's happening right now. And so I've appreciated being a part of WPSR and just plugging in to things not only in WPSR but also beyond, and also just writing with Nick and finding out well, this one initiative, should I be a part of this initiative or not? And what do you think about it? So I've had opportunities to present at the Washington Climate Assembly. I write letters as often as I can but not as much as I would like to. I provide testimony. I send written testimony and for legislation, not only that WPSR is most active on, but other pieces from 350 Seattle. I'm also active with them. And I also use my science as a vehicle for advocacy. So I focus my work now on power outages, and I think by helping people see that the things that they care about are being impacted, I think it's really meaningful. It's just very powerful for people to see this is affecting me. It's affecting the community that I love and the things that I care about. So that's all I got.
Thank you, Claire. Claire has been a fantastic help on the climate task force, and next, since the two programs represented on this webinar specifically are myself for the climate and Tasia, who I will let further introduce herself when she speaks, but heads the economic inequity program at WPSR. So we asked a task force member from that program to come and speak about her experience and why she gets involved in this work. And so it's my pleasure to introduce Laura Wilson, who is a family medicine resident at Swedish First Hill and the King County Downtown Clinic. She worked previously in global health, and she looks forward to graduating and having more time for advocacy, and is very much in the stages of learning about how she can best advocate as a health professional, and we are so lucky to have here. So I will let Laura speak for herself.
Yeah, thanks so much for having me, everybody. It's awesome to see how many people are showing up for this event, and just awesome that the WPSR is putting it on. So I have come to the task force relatively recently in the last year, as my residency is letting up a little bit. And it's something that I've been looking forward to over the last few years for a few reasons. I think for any of us working in healthcare, the US healthcare system carries a lot of potential for moral injury. That's kind of our new word for burnout that we've been talking about. Because it's an unequitable healthcare system, and it amplifies an unequitable society, and we work in that every day. And so the opportunity to, in the future, get to work on advocacy was something that I look forward to be able to have a voice in the systems that I feel like constrain so much of my work throughout the day. And then as an extreme extrovert, we all like having community around the things that we like to think about and the things that we care about. And so working in advocacy, you just naturally get to build on that community. I think as health professionals, we bring a lot to policy discussions for a lot of reasons. One, health, like most fundamental topics, like environment, like education, the investments that we make now take a really long time to pay back, and politicians work on a much shorter time frame. The electoral time frame is shorter, and so I think those are exactly the topics where advocacy tends to be most helpful, where we kind of help them reprioritize things. And as health professionals, we are privy to just such incredible intimacy from patients. You know, they implicitly trust us. They talk to us about their mental health. They talk to us about their sex lives. They talk to us about their financial issues. And having a whole panel of people who confide in you that way, it gives us a really unique perspective. It gives us really unique insight into communities. And when we speak with that insight, because we're recognized as, you know, having a unique perspective, and also because of the degrees that a lot of people have in this field, our voices tend to be listened to in a way that our patients' voices unfortunately aren't. So when I started being able to engage in advocacy again, I really focused on WPSR because one of my big passions is tax policy. And I always thought that to get to work on tax policy, I was going to have to work with non-health organizations, and was so delighted to find an organization that fully saw tax policy as within the realm of what health advocacy organizations should be working on, because that aligns with my beliefs as well. But that kind of broad structural thinking is pretty unique. What I've come to discover since working with WPSR is that whatever effort we put in is really efficient through them. So it requires a commitment to join one of the task forces, but they have so many shovel-ready projects in terms of they have the contacts, they have the support, they have the know-how to help you latch onto those projects and advance your interests in any way that you want. And the staff is, cover your ears, but they are really brilliant, very strategic, and very hardworking. And it's just an amazing way to feel like any efforts that we put out will really be amplified. And then on top of that, there's the community side of things. So WPSR is really well established. It has this long-standing community of committed, knowledgeable health professionals. And I've just joined in the time of COVID, but we've started doing these little breakout groups during our meetings to do one-on-one conversations. And it's a really, really lovely kind of additional layer to doing this work. I've had a great experience. I would love if some more of you were interested too.
Thank you, Laura. That was so great to hear from you and from Claire. Nick said this already, but you know, I speak on behalf of the organization. We are so happy and lucky to have your voices, your expertise shape and guide our advocacy work. And you both have really busy schedules, so thank you for being here tonight. Nick mentioned, but my name is Tasia Wood, and I'm kind of Nick's counterpart in the economic inequity space at WPSR. So I organize the Economic Inequity and Health program. I'm grateful for you all being here tonight, and for Claire and Laura for really setting the foundations of what we want to talk about and why we're having this conversation this evening. You heard in both of their presentations that there's a real critical value of the health voice, and we're talking like across the spectrum of the health profession, you know, not just physicians. There is so much value and knowledge in that space to bring to the political advocacy landscape, and particularly in this moment, in this context of a public health and economic catastrophe of COVID-19. So that's really why we're here tonight. Two goals. One is to emphasize how impactful health voices are, especially during this legislative session. And the second is, like Nick said, to really demystify the legislative process, to break it down and to make it feel a little bit more accessible, because theoretically it is designed or intended to support civic engagement, but it can often feel really opaque, often intimidating, distant. And so what we want to do is just highlight some of the key areas that you can engage within the legislative process to affect change. And we also want to show you some ways that you can do that, like really, really quickly, understanding that many folks have really full lives. And so there are some ways that you can make a difference in under a minute. So next slide, please. The overview of the evening, just really quickly. So we're going to give a sort of overview of the legislative process. We'll highlight some key moments where you can participate in that process and be, you know, an effective advocate. We'll also briefly touch on some bills that we are tracking in each of our programs and sort of where they fall within the legislative process. We might not have time to get into like the specifics of, or too in depth in the specifics of the policies, but we're always happy to answer follow-up questions. And we'll also have a Q&A at the end. So next slide, please. Okay, so just scaling out a little bit, super basic, quick overview of the Washington legislature. So this is likely review for many folks, but as a reminder, our state is divided into 49 legislative districts, and each district has 2 representatives and a senator. And these elected officials occupy the 2 chambers of the state legislature, the House and the Senate. In Washington, Democrats hold a majority in both chambers. So in the Senate, there's a 28-21 majority. In the House, a 57-41 majority.
Dead. Not a law, but it can be run again, and people do and often try again. So can we go to the next slide, please? Quickly to recap, I kind of just went over the phases again: first, second, third reading, amendments, if there are any, governor action. Within there's the 2 committees that we mentioned, and there's all the public hearings within each of those committees and lots of ways to influence the process. But here are some of the key things that are easy for folks to do, relatively speaking, that are just great, awesome, simple ways to engage, especially if you've never engaged in legislative process before. First is testimony and written comments. These are super, super important for any sort of committee action. Whenever there's a public hearing on a bill that you care about, it's really, really critical that you enter your opinion into the legislative record so that you can demonstrate your support for the passage of that bill. It's also a good chance to bring up specific issues with certain bills. If you like a lot of it, but not certain things, written comments provide a lot of flexibility for those little nuances to shine through. And it is important for people to say those things. They are read, and it is often actually a very powerful advocacy tool to make a really well thought out argument about why certain things should be in there and why certain things should not. The third thing is direct lobbying, and this doesn't have to happen during committee meetings. So, I mean, you guys all know what lobbying is. I mean, I think there's probably like a pretty poor reputation for lobbyists out there as these like monopoly guy, monocle cartoons with money sacks slung over their shoulder, running around handing out $10 bills to legislators to get their bills passed. But that's actually not necessarily the case. And I will say really quickly, it's kind of a fun fact. Washington has a reputation in the country as the cleanest legislature, like the most amenable, the most agreeable. People are really trying to get along. There's less underhanded money tactics. I mean, we really have this reputation as one of the most squeaky clean systems out there. And so I think getting involved in advocacy, this is like, you couldn't have picked a better state, because you'll actually see results of your lobbying. It won't just be shrugged off. And so for that reason, it's really, really important that people get involved with this. So key moments: committee action, like I mentioned, testify, give written comments, sign in this pro. Floor action, do all the same, lobby your legislators. And I'd like to quickly give some tips and tricks about, what it means to sign up to meet with your legislature, because it can be intimidating, and I get it. I mean, before I did any lobbying work, I was like, I can't email and get a meeting with the legislature, that they're busy. They don't want to hear from little old me, or they're just impenetrable, or whatever it is. But the one thing I was really, really pleasantly surprised to find out is that legislators live to talk to their constituents. They would like nothing more than to hear from you, meet with you, see you face to face, hear you out. I think it's really, really important that people understand that they're just people. They have day jobs. They work at your bakery. They make your sandwiches. They are not shining icons up on a hill, and they would love to get in touch with the communities they serve. This is their blood life. It's their bread and butter. And so I think, whenever somebody says they're intimidated about reaching out or having a meeting or not knowing what to say or coming off as dumb, I just remind them that these are very casual. They're 15-minute meetings typically, and it's a conversation. Yes, prepare remarks. Yes, prepare talking points, but they are going to be very friendly with you. They are not going to be very intimidating, and they're going to be able to engage on a lot of really important points that you might not have thought that they would be able to give you good engagement with. So the way to do this is very easy. You can find your senator and representative on the ledge.wa website. There are links here. We'll send it out. It's very, very easy. On their page, or on the ledge.wa website, when you look them up, there will be a link to their personal page. And what I do, and what I think is the best way to do this, is go to their personal page and click the Contact Me button, and you'll be directed to two options. One is you will get the email of the legislator themselves and their staffer, in which case you just copy them on an email and then include the things that are listed here that I'll mention really briefly, send it off, find a time. And now it'll be a Zoom time. Normally you would actually go into their office and meet with them and make your voice heard. Some people have a form that you can fill out that makes this easier in some cases, and depending on how well that they run these things, not so easy in other cases. But that will just be, you fill out your name and information, and you pick a day that's available on their calendar and sign up for a 15-minute meeting. If a legislator is not available to meet with you at a time that you're available to meet with them and you can't reschedule or find a time, meet with the staff. They are just as good. They take really great notes. They report everything back to the legislature, and everything you say will be recorded in the record for that legislature regardless. So it's, really important to note that even if you're having a hard time getting on someone's super busy schedule, you can always just meet with the staffer, and they'll be super friendly, and you'd be surprised at how knowledgeable they are. They're often able to even give answers about how the representative or the senator is going to vote. Sometimes they'll be like, oh, I can't speak, but oftentimes they'll say, no, we're on board with this. We're going to vote this way for these reasons. And you can still have a very meaningful conversation. Last thing I'll mention about this is when you're setting up these emails, there's a couple things that will make it really streamlined and easy if you can include this information in there. The first is your name and district. It's most important because they really want to meet with their constituents. And if you are a direct constituent, they will make time for you. It's their job to meet with you, and they really, really want to. So please don't sell yourselves short. You are important advocates for them, and they really, really will make time to meet with you. Mention what issue you want to talk about. If you have a specific bill or a specific action, maybe there's a bill coming up in committee that you want to bring up to them, mention it. If not, it's okay to stick with the general issue that you want to talk about. Mention everybody that's coming. Mention if you are a part of an organization or meeting as an individual or a group of individuals. Give them a range of dates that they might be able to meet with you. And then unless you're doing it with the portal where they actually have a time you can fill in, and that makes it easier in some cases. And then a day of phone number contact. They'll typically ask you for that anyway, even if you forget it. So it's not the end of the world, but they love to have someone's phone number they can call 5 minutes before in case there's something that comes up. Because sometimes that happens, especially at Olympia. I've had a lot of meetings where you'll have a 15-minute meeting with somebody in their office, and then they'll have to run out to go to a committee meeting or something. And they'll text you and say, okay, can we walk and talk for 10 minutes? And then you walk with them along the hallway and give your points, and they record things and run off to the committee meeting. This year might be a little different. Yeah. I mean, who knows? I don't know. We're all kind of guessing as it gets set up and plays out anyway. But all that to say, lobbying is really important, and your voices are really important. And it's not so hard to set up meetings. So I very much encourage everybody at the base level to at least introduce yourself to both your representatives and your senator and talk about what's important to you. Okay, next slide, please. So this year, like I said, is very different, and that means a couple things that are important for advocacy. The first is that it's all virtual, as you all know, and that's kind of playing out in various ways. It means that anybody and their dog can sign in to testify or give written comments or as pro for a committee hearing, because you don't actually have to be in Olympia anymore. And so for some hearings, they've been limiting verbal testimony. Like for certain bills, like for the Clean Fuel Standard, they wanted only 6 to 8 because they generally knew what people were going to say. And so in those cases, the strategy this year is to kind of try and put together a panel of people that represent various interests and stakeholders, one of which is always the health voice. And you guys have, as health professionals, the most power this year, especially to present a really compelling argument about why these things impact people and why these things are important. The other thing that's very different this session is that there are fewer bills because they're limiting any bill to having to deal with one of 4 topic areas. Those topic areas are COVID, economic relief, the environment, and racial inequity. And so any legislator that wants to introduce legislation this year has to explicitly address one of those issues, which means a couple of things. It means, one, there's fewer bills, but for a guy like me who focuses specifically on climate legislation, that means there's a lot of environmental bills, because 1/4 essentially of the bills out there are going to be dealing with the environment. And so it's important this year to really think through what are the priorities. There's going to be flooding people signing in as pro for certain things. So being strategic about when you engage and how you engage is even a little bit more important this year, just because there's so much going on, which is that last point here. Working in the coalition is more important than ever. There are resources that folks can access. We are one of them and can sign you up in line with a coalition strategy so that your voice is amplified as a health voice within a panel of people trying to speak to the various aspects of whatever an issue might be. But that's not to say don't do this unless you're part of a coalition. It's just to say if you really want to be super, super strategic, we can help you engage within existing efforts in ways that will take your voice, that gives you the most mileage. But it's always great to sign in and pro. It's always great to provide comments if you can on things that you care about. And it's always great to lobby. So I don't mean to discourage you at all. Just saying there are some nuances this year that make strategy a little bit different than it was in previous years. Next slide, please. Okay, that's the legislature. And I'm not going to say anything more about that. I know it seems like a lot of information, but when you think it through, there's only a couple key opportunities. The advocacy is really important, and focusing in really specifically on those opportunities can make it a lot simpler. And I think that's really the key that we'd like you to take away from this presentation. So now, Tasia and I would like to briefly introduce some of our priorities this year, just to give you a sense of what we're working on in our task forces. I'm going to do some climate priorities. Tasia will do some economic inequity priorities, and just kind of give you a sense about what's coming up next. And I'm sure everybody's already read the text on the slide while I've rambled on, so I might as well get going. The first priority for us in WPSR is the Clean Fuel Standard. And this was the example. I've mentioned this a couple times throughout the presentation, but the Clean Fuel Standard is 3 years in the making now. It was first introduced in 2019, and it basically cleans up fuels in the transportation sector, which accounts for half of the carbon emissions in Washington. and an inordinate amount of premature deaths. The impacts are really disproportionately, inequitably distributed across populations in Washington. This would really go a long way to preserving public health through air quality and making a really huge dent in our climate emissions. And so we think this is like the most no-brainer number one thing we need to pass. It passed out of its first committee, the Energy and Environment Committee in the House, on the 21st. And we just learned today that it has a hearing in appropriations next Friday, the 4th at 3:30, which is the example hearing that I took you guys through on that previous slide. So write-in comments is pro. Consider signing up to give verbal testimony. I will, of course, follow up with more instructions and resources for people to get more involved. But at the base level, everyone should be able to sign in as pro. It's very easy. It takes a minute. Now, quickly, other things. One other big priority is the building electrification piece. So every year, the governor comes out with his priorities for different issue areas. One of them is the environment. Within the environmental priorities, his number one issue this year is decarbonizing our building sector. This has to do with replacing the use of natural gas with electricity. So phasing out gas for heating with things like heat pumps, because Washington has a very clean electrical grid, relatively speaking, and this is a really awesome opportunity to protect health and also impact what is the fastest growing source of carbon emissions in the state, fun fact, is buildings. And they also account for huge amounts of indoor air pollution that can have a lot of terrible consequences for childhood asthma rates and premature deaths. And so this had a public hearing on the 22nd. Now we're waiting for committee action to see where it's going to go next. But it's important right now to keep this in the messaging in lobby meetings. If anybody wants to set up meetings with legislators, this is something that we can really hammer on right now. And it's the first in the country. I mean, we're the first state in the country to introduce a statewide bill that would decarbonize the building sector, and that's pretty cool. So this is also a big priority. Other things, we're tracking a couple other things. Those are the two really, really big, shiny objects, but there's some amendments to the Growth Management Act that we think are important for health and for climate impacts. And then the HEAL Act, which is the Healthy Environment for All Act. It was first introduced in 2019. This would essentially codify environmental justice recommendations into the ways that agencies make decisions. So trying to build more equity in the way that we manage our environment. Also kind of a no-brainer and sort of a end of a 3-year campaign on this, but really, really important to push it. And I'll stop there because I know there's a lot of things I could say about all these bills, but if you want to learn more information specifically about these, or you want to nerd out about the policy, or if you're curious about getting involved in advocacy, email me at the email down there, nick@WPSR. Check out the follow-up resources that we'll send at the end of this presentation sometime in the end of the day tomorrow. And then I'll give it back over to Tasia to talk about economic inequity priorities.
Thanks, Nick. Yeah, could we go to the next slide? So for our program for economic inequity and health, this session, we are tracking bills kind of under 3 major buckets. So one is in tax reform and raising progressive revenue. Some folks may know that Washington has the most inequitable tax code in the country. And so we are really concerned about the disproportionate burden that places on the lowest income folks in our state, and a disproportionate harm on BIPOC communities. So that's one area that we're tracking. The other is around housing and homelessness. We want to keep people housed. We know that there is a incredibly strong correlation between access to safe, equitable, and affordable housing and long-term health outcomes. And this is like critical right now in the pandemic, and with this potential wave of evictions following the end of the evictions moratorium, which is set to expire at the end of March. And then we're also tracking some bills around investments in early life and early learning. Again, like too many bills for us to fit on a slide. But a couple ones that I wanted to highlight was the recovery rebate. So this is House Bill 1297 for a working families tax credit. And what this is basically our state's version of the earned income tax credit, federal tax credit. In the follow-up email, I will provide a fact sheet that kind of breaks down in really accessible language what this, the nuances of this bill. But basically, it would ensure that families with the lowest income receive more support by getting an annual cash rebate. It would be a $500 rebate plus an additional $150 for up to 3 kids, so a total of almost $1,000. And we actually passed in 2008 at the state level a state version of a earned income tax credit, but it has never been funded. And we tried last year, it didn't go through, but there's a lot of momentum this year for this credit because for obvious reasons, in the economic crisis, folks need cash and they need it to be flexible and they need to have agency in how they spend it. And a really important piece of this bill is that it is a non-negotiable for the coalition who is pushing this bill, and WPSR is part of a coalition called the Working Family Tax Credit Coalition, that this bill is available to people who file taxes with an individual tax identification number, an ITIN number, and that is folks without a social security number or who choose not to use a social security number for safety reasons. So this includes undocumented immigrants, certain student visa holders, some survivors of intimate partner violence, and others. And these folks are unjustly excluded from unemployment insurance and other federal stimulus efforts. And these are people who are paying taxes and paying into our system. So it's a really important bill. And like I said, there's a lot of momentum. It has 46 co-sponsors, and 6 of those are Republicans. So there is some bipartisan support. And we feel really good about it in the House. And it was introduced, I think, on the 18th. And it has the first Finance Committee meeting on Tuesday, February 2nd at 1:30 p.m. And so we would love for folks to sign in pro for this bill, and it's linked on the slides, but again, we'll send instructions in the follow-up email. You can actually sign in pro or submit written testimony as soon as a bill has been assigned to a committee. Has a public hearing scheduled. So you could do this tonight, and you can do it up until an hour before the hearing starts. So that goes for signing in pro as well as for signing up to give verbal testimony. And I believe you can submit written comments through the end of Nick can correct me on this because he probably has the detailed, I think a day past the hearing, Nick. Yeah. Okay. So so that's where the Working Family Tax Credit is. Like I said, we feel really good about it in the Finance Committee because the Finance Committee this year in the House is as progressive as it's ever been. It's chaired by Rep. Noelle Frame, who is a champion for progressive revenue. But then it will move on to the Appropriations Committee in the House, and then the Rules, and et cetera, and then it has to go to the Senate. So there's a path, long path, but a path to victory. So that is the tax credit, the Working Family Tax Credit, or recovery rebate, as we also refer to it as. And then I just put up some of the housing bills that we're watching. So we're looking at kind of 2 buckets of housing bills, and we're working really closely with the Washington Low Income Housing Alliance, and really taking their direction for where to engage in our advocacy efforts. Again, like Nick said, this is a time when strategy is important because we don't want to dilute the space, and we want to have like a really strong push behind the bills that we believe are the most important for protecting the health of our communities. So within the tenant protection bills, we're looking at SB 5160. This is a Senate bill that would provide like a pretty comprehensive range of tenant protections, both during and after the pandemic. It would ensure renters have rights to repayment plans from debt accumulated during the pandemic, right to legal counsel, preventing evictions due to debt accumulated, and it would require landlords to have just cause in order to evict. So that one had a public hearing on the 20th. We're still waiting to see movement on that bill, but we will be contacting the committee to urge them to support this bill. The other bill under sort of the tenant protections bucket is a bill, HB 1236, and this was introduced by Macri, Representative Macri. And this is a bill that protects against discriminatory and arbitrary evictions. So it essentially would require landlords to have just cause in order to evict, which seems fairly intuitive, but we have a no cause eviction policy and tenants can be evicted with 20 days notice. And so this bill would introduce a set of would require a landlord to have just cause, and there's numerous causes that they've outlined that are reasonable to evict, but it would require them to identify a reason. And so this one had a public hearing just this week on Tuesday. Good support on the pro-con. There was 463 pro signed in, 89 cons, although there were more cons who showed up to testify. And that one has an executive hearing on the 4th. So that's good news. That means it's moving through. In terms of rental assistance, this bill 1277 is basically a bill that would provide a revenue source for eviction prevention and housing stability services. So it's a really important bill that would create like a sustainable funding source for rental assistance and homelessness prevention through a state document recording fee. And tomorrow, actually, there is a executive session. So we'll see if it moves out of the Housing and Human Services Committee and off to the Appropriations Committee. So those are just some of the ones that have had some movement this week. Again, I will send more information about our policy priorities in follow-up. And if there are immediate ways that you can engage, I'll include that information. And if you want more information about how to engage throughout the session, because there are so many opportunities and it is it's a long process. My email is at the bottom of that slide, tasia@wpsr.org. Happy to chat about any of these policies we've talked about. Okay, next slide. Okay, yes, so I hope that gave sort of a good overview of the process and some of the bills and the priorities that we are advocating for this session and kind of where they are in the legislative process. And so that kind of concludes our policy and program presentation. And before we go to questions, I just want to put in a plug for another great way to get involved with WPSR or learn about our organization is to register for our Health Justice Gala, which is a virtual event. It's going to be our main fundraising event. It's happening on March 6th. Super low barrier. It's free to register, but of course you are welcome to make a donation. And yeah, you're gonna hear from leaders in the organization. There's gonna be a keynote address from environmental and economic justice advocate and activist, Dr. Mustafa Santiago Ali. The URL for how to RSVP is there, and we would love for you to join us. And again, we'll send more info about that in the follow-up. And with that, would like to open it up to any questions folks have.
And thank you for sitting here and listening to us. We know it's later on a Thursday evening, but we really appreciate you guys taking the time to be here and engage with us. So thank you.
So I have a question. If we
please.
have a legislator that we know supports a particular bill, is it still useful to connect with them and advocate to them?
Yes, absolutely. Just because they support it doesn't mean they can't be encouraged or emboldened to be a stronger champion or to stick their neck out and encourage their colleagues to also support a bill. In fact, a lot of what we did at the beginning of lobbying strategy for some of our priorities was to target people who we knew were a yes, to push them to be a super, super solid yes, and to make them really, really try and reach out to their colleagues and make sure they're emboldened in taking the right thing.
And it's also great to thank your representatives and senators when they support a bill that that is a priority for you. They get a lot of criticism. They welcome when they hear from their constituents that they're happy with the decisions that they're making.
One last thing I'd say about that is if you're meeting with representatives, say you're meeting with Joe Fitzgibbon on his own bill that he's sponsoring, and you know that he's, of course, a super, super strong champion. Something I like to always say in these lobby meetings that I think comes across well and also can be useful in those situations is to pose it like, what can we do to support you in getting this across? What can we do to be a resource for you? What do you need from us to help you convince your colleagues to get this across the finish line, to get this to the governor's desk? So even if they're like so on your side, being there, showing up for them and demonstrating that you're there to be a resource and supportive, they'll often thank you for that and give you some really solid, concrete ways that they could use your help in doing that. So always helpful. We have some questions on this document, so maybe let's talk about those, and then there's only two, so we can just go through them quickly and then open back up, if that sounds all right to you, Tasia.
Nice.
So let's see, the first is, if we register pro-con or give written comments at an earlier stage in the bill moving along, should we do it again when it is back on the schedule or next committee review? It's a great question, and it makes sense because there's so much repetition in this process. It kind of feels like sometimes if you've said your position once, you've said it every time. Different committees, different records, yes, please. For clean fuels, we tried to show up when it was in the Environment and Energy Committee. We'll do the exact same thing when it goes to appropriations next week. So short answer is yes. I don't know if you have any.
Yeah, and I would just add also, different committees, and sometimes you might want to tailor your testimony a little bit to those different committees. So if it's a finance committee, you might want to emphasize sort of the economic arguments more. But yeah, again, each of these committees have sort of a different political tenor, and the chambers do as well. So like I said, with the working family tax credit, we're pretty confident. In the House, we're definitely confident. With the finance committee, the Senate is going to be a different story. So at every opportunity, and again, because it's so accessible this year, they are getting more and more engagement, but it really makes a difference when you have hundreds more people signing in pro versus con. It gives sort of a temperature check, and they announce that usually at the public hearings, so going in and kind of getting a sense of where constituents fall, pro or con. Did you want to read the next question, Nick?
Oh, yes, totally. I was going to say, too, if speaking up on a Zoom call with a bunch of strangers in blocks, Brady Bunch style, is too intimidating, you can put it in the chat and we'll get to it as well. I totally get how it can be super awkward to speak up on a Zoom call. But okay, the next one, asking for a fact sheet. Yes, we should definitely include that in the follow-up. And then there's one more question on here. It says, this sounds repetitive. I might have to advocate on votes in the Committee of Origin, the Rules Committee, and then at the whole House or Senate. Lots of repeats, question mark? Yep. Lots of repeats. Do it every time. It's important.
And then there
You're
was
just so
Charles
thorough, huh?
Sorry, I was just reading off of the chat box and the side correspondence that Charles and I had going about the fact sheets for the working families tax credit, and just wanted to raise that here, Tasia, for you as well, or Nick, if you have thoughts on the use of fact sheets in general.
Absolutely. A little weird this year because last year they stopped accepting. So whenever you're lobbying the legislature, it always helps to have a fact sheet to record your position. But last year they made us stop turning in physical copies because then they had to scan them and add them to the record manually. And they got so many that they were like, whoa, stop this. We don't have the time for this. And so what the protocol last year was to email them ahead of the meeting the day before with the actual fact sheet. And then they would just pull it up during your meeting, which is a departure from the typical protocol. This year, it's all very, very strange. I would say the same thing probably applies. I mean, my instinct would be it's always helpful to have a fact sheet for a legislature, especially if you know they're going to ask certain questions that it'll just address right there. It's great for them to have that, and they can use it for their own resources as well. But maybe just email it to them when you're setting up the meeting, or when you have a meeting time the night before the meeting, you can send it to their staffer, and their staffer can take care of processing that. But that's a great question. Thank you.
And a follow-up to that is related to your thoughts on the use of Twitter for connecting with these folks, or even their staffers, prior or post.
Yeah, that's a great question, Adam. And social media has been, increasingly part of advocacy strategies, and especially this year. And in our coalition work, we've been experimenting with different ways. And an example of this was, what day was it? Sometime this week, sometimes last week. I think it was last week. We'd had part of the Balance Our Tax Code, which is the coalition that's really sort of leading the advocacy around progressive revenue tax reform options, had scheduled a Twitter storm, which was essentially an hour where everyone in that coalition tweeted at legislators, pushing for and elevating the need for progressive revenue. And I wish I had the data from that, but I know that they were really pleased with the scope of how many folks that reached. And there's all kinds of data metrics. And again, our comms lead would be a great person to direct more questions around how to extract kind of the metrics and how successful your campaign was. But it's really, really effective, and it's a way to directly connect, or at least call out your legislators. So yeah, that's something that we are all kind of developing and learning and putting especially more attention to this year.
Yeah, Charles?
There we go. Sorry. Hi, all. Thank you for such a great presentation. Earlier, I was walking home, and it's funny when the doctor, I forgot her name, the doctor who was at the public health clinic downtown, I was standing right in front of her clinic, waiting for her to walk out or something while I was walking home. So it was a great moment because I had it on my iPhone as I was walking. So I want to also say you guys really covered some wonderful basics, which I have gone down to Olympia many a times, and I still didn't know all this. So a couple of questions. One is, Tasia, is there not a specific bill that we're supporting for progressive taxation that calls for something specifically about capital gains tax or increasing the basic, some basic tax revenue that or is it not there? Yeah, that's one question.
Yeah, thanks, Charles. And I just put the fact sheet, and I know, thank you, Adam, for that great link to Balance or Budget and Policy Center. And I put in one that's specific, an updated fact sheet for this year, because the credits changed a little bit from last year. Yes, absolutely right. There is going to be several likely that are introduce this session. Capital gains has been introduced. It was introduced in the Senate. And I'm just looking up what the actual bill number. So that was Senate Bill 5096. It had a public hearing January 14th. This one was basically this was the capital gains that the governor had requested. So this was introduced by Senator Robinson, and this one doesn't have any direct appropriations for the revenue that would be raised. It's sort of across the budget. So what I've been hearing is that we're not totally sure this is going to be the vehicle for getting capital gains passed. And there are also rumors that a capital gains is going to be passed in the House as well. And I think I see Adam just dropped a wealth tax that was just introduced by Rep. Frame in the House. Rep. Frame is the chair of the Finance Committee in the House. So that has, again, really good prospects there. I haven't had a chance to look at the wealth tax yet, and I know that Balance Our Tax Code is evaluating that just to make sure it aligns with the sort of basic priorities for the coalition, but I'm sure it will. I know it's a progressive tax. So capital gains has been introduced. It had a public hearing. There was a lot of support. There was also a lot of opposition that showed up. It hasn't been scheduled for an executive session yet, but there is a lot of support for capital gains. And I know that capital gains has been attempted many years, but especially given the economic crisis and the shortfall in the state revenue, in the state budget, capital gains has had more momentum. And so we just have to see. I think that there's going to be a House capital gains that might serve more as the vehicle to get it passed, but still to be determined. But we're watching. We're watching as more of them get dropped.
Cool. Keep us
Yeah.
updated.
Yeah.
On that.
Sure.
You mentioned Noel Frame is the leader of the HB 1297. Is that right? She's the one who introduced the bill.
No, so sorry. Rep. Frame is the chair of the Finance Committee, where the bill has a hearing on Tuesday. Who introduced the bill was Rep. Ty, and it was actually co-sponsored by Stokesbury, who's a Republican. But yeah, Rep. Ty is the champion, and Senator Wynn, when it gets to the Senate, will champion it there as well.
Okay, thank you.
Thanks, Charles.
So we have one more minute. I'm thinking if there's one more question, we could probably do that and then wrap up. I'm doing my Zoom facilitator thing where I count down from 10 in my head and make sure that everybody has a chance to say something. But it's okay. If there's no questions, that's totally fine. It seems like we're right at 7:30. So I think, to be respectful of everybody's time, thank you all so much again for being here and for being part of this process. And I know it's really strange this year and looks really wacky, but we have polling to suggest that health is like the most important thing. So you guys have such a unique platform this year, and we really hope that you'll use it. And if we can help you amplify that, we would love to be the conduits of your advocacy. So Teja, if you have any final words, I'll let that.
Yeah, just thank you so much for being here, and we'd love to hear from you. If you want to talk more, learn more, get engaged in any capacity, and yeah, look forward to a follow-up from an email from us soon with more info and links to a bunch of things and ways to get engaged coming up. So yeah, thank you all. Have a wonderful evening and good night.
Thank you.
Thanks, everybody.
Hey.
Thank you all so much.